Hello everybody. Today I'm going to be speaking about in vitro fertilization, or as it's shortened, IVF, which simply means fertilization in the lab. Unlike artificial insemination, which combines sperm and egg inside of the womb, it combines sperm and egg outside of the womb and inside of the lab. It is used less commonly than other treatments of infertility. Only 5% of most couples seek out this specific treatment, and it is usually used as a last resort if all else fails, as a procedure on average costs around $12,000. So what exactly is IVF? Well, let's start with the history of it. Initially, when this type of birth was being experimented with, there were many trials that ended in an ectopic pregnancy, which means the fertilized egg implants were outside of the uterus. There was also a large question of whether or not this method was ethical to do, saying it was unnatural or bizarre. Many doctors were fired for controversial research methods. But by 1978, the first successful live birth from in vitro fertilization happened in England at the hands of gynecologist Dr. Patrick Steptoe and Dr. Robert Dickens. This started sort of a race on who would be the next country to produce a test tube baby. Australia was the second country to announce that they succeeded in delivering a baby that was the result of IVF. And the US was right behind them in 1981. The hype of this revolutionary discovery impacted many, and more people accepted the concept over time. It is not used as much today, however, especially in the US, as there are many other methods that have been discovered since then, and they're usually more successful as well as less expensive. Some of these methods include fertility drugs or surgeries to treat fallopian blockage or other defects. Other factors that can prevent conception are fallopian blockages, low sperm count in men, issues with fallopian tubes or the uterus, ovulation diseases, or sperm that isn't strong enough to survive the cervical mucus, with age being a big factor as well. After the emotional process of weighing the options and finally deciding to go with in vitro fertilization, the process begins. Doctors usually start off by giving the woman medicine to help induce ovulation and produce multiple eggs. This can take up to 3 months. Whenever these eggs are ready for retrieval, they are then taken out and mixed with the sperm in a lab. If the eggs are not ready for fertilization, however, they have a chance of developing abnormally. The embryos will eventually hit the right stage and will be inserted into the uterus with a catheter, usually about 3 or 4 to help increase success of pregnancy. After the procedure, the woman is usually asked to stay in bed for a few hours to help recover. This procedure is a bit dangerous, however, as using multiple embryos can lead to health risks or even multiple pregnancies. Health risks can include heavy vaginal bleeding, pelvic pains, severe stomach pains, and a 10-pound weight gain in less than 3 days. Now, the success rate for women under 35 is around 39%, while when they are above 40, it goes down to around 12%. However, this is getting higher and higher as doctors are becoming more proficient in the field. Hopefully, in the future, doctors can heighten the chance of success with this method, as in extreme cases it does tend to be more successful than the others. And many discoveries in the past 20 years have improved this and many other infertility solutions. That's all for today, and thank you all for listening.